Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's daily bulletin. India's federal government asked states to identify emergency hotspots and ramp up testing for COVID-19 after the country recorded its highest daily case count since September. There were 6,050 new cases of COVID-19 in the last 24 hours, the Federal Health Ministry said on Friday, continuing a sharp upward trend since last year. While considering a petition challenging the rules where medical students cannot change their course after getting admitted to it, the Supreme Court bench has expressed concern over vacant SS seats across the country. It said that we are aspiring to be a country with top-notch healthcare and we say that we are short of doctors, but in the same case we have seats going vacant for the doctors, noted the top court bench of Justices B.R. Gawai and Pankaj Mittal. Asking doctors to set an example of good habit that others can follow, the DGHS under the Union Ministry of Health and Family Welfare has directed them to avoid alcohol in medical conference, workshop, seminar, CME. Writing to all the medical associations across the country, DGHS Professor Dr. Atul Goyal has mentioned that being health professionals, we should follow the healthy lifestyle and it may be advised that alcohol in any form may be avoided in medical conference, workshop, seminar, CME to set an example of good habit which can be emulated by others. A spoonful of sugar may help the medicine go down, but eating 6 or more a day could see you needing serious medical attention. That's according to an umbrella review of thousands of studies looking at the effects of sugar consumption on health, which was published in the journal BMJ this week. Researchers in the United States and China reviewed 73 meta-analyses, which included 8,601 studies, and found that significant harmful associations between free sugar consumption and 45 negative health outcomes, including but not limited to asthma, some cancers, depression, diabetes, gout, heart disease, high blood pressure, stroke, tooth decay, and early death. Free sugar, aka added sugar, is defined as basically any sugar added to a food or drink. This includes sugar added during the processing of foods such as sucrose or dextrose, foods packaged as sweetness, sugars from syrups and honey, and sugars from concentrated food or vegetable juices, according to the FDA. The main sources of added sugar for most Americans are sugar-sweetened drinks, baked goods, desserts, and sweets. The Supreme Court on Wednesday directed all states and union territories to implement in 3 months the guidelines formulated by the Center to Check Unnecessary Hysterectomies, a surgical procedure to remove the uterus of poor women just for racking in high insurance fees from governments under various health insurance schemes. The law officer said that he proposed a strong and robust mechanism of monitoring and evaluation of the issue. There has to be reporting of the hysterectomies causes, especially for women below the age of 40 years. Bringing good news for the medical aspirants in Odisha, the NMC has given its permission for 100 MBBS seats at the Government Medical College in Kalahandi district of the state. With the NMC nod in this regard, the medical college will start admitting students from the current academic year. Sharing the news, the Office of the College and District Magistrate Kalahandi tweeted that NMC has approved opening of Government Medical College at Bhavani Patna, Kalahandi with 100 MBBS seats from the academic session 2023 and 24.
A new study led by Mass General Brigham researchers sheds light on the relationship between the risk of Alzheimer's disease and age of menopause and use of hormone therapy or HT. The results indicate that early age at menopause may be a risk factor for AD dementia, but that women who were prescribed hormone therapy around the age of menopause onset did not show increased risk. Buckley and colleagues used positron emission tomography or PET neuroimaging to study how the presence of two proteins involved in AD dementia, that is beta amyloid and tau, related to age at menopause and HT use. The researchers used data from the Wisconsin Registry for Alzheimer's Prevention, one of the few longitudinal studies on AD dementia that includes detailed information on menopause and HT use as well as PET neuroimaging. They analyzed PET scans from 292 cognitively unimpaired adults to determine levels of amyloid and tau in 7 regions of the brain. Tau, which is known to be present in greater quantities in women compared to men in these brain regions, was a primary focus of the investigation as its presence may offer insight into the sex-specific aspects of AD dementia and the risks that postmenopausal women may experience even before they begin to display symptoms of cognitive decline. Pregnant women whose household tap water had higher levels of lithium had a moderately higher risk of their offspring being diagnosed with autism spectrum disorder, according to a new study led by a UCLA health researcher. The researchers who analyzed lithium levels in 151 public water works in Denmark, representing the water supply for about half of the country's population. To identify which waterworks supplied mothers' homes at the time of their pregnancy, the researchers used address information from Denmark's comprehensive civil registry system. Using a nationwide database of patients with psychiatric disorders, the researchers identified children who were born in 1997 to 2013 and compared more than 12,000 diagnosed with autism against 63,681 children who did not have an autism diagnosis. The researchers also controlled for maternal characteristics, some socioeconomic factors, and air pollution exposures, all of which have been linked to increased risk of autism in children. Statin therapy does not exacerbate muscle injury, pain, or fatigue in people engaging in moderate intensity exercise, such as walking, according to a study published in the Journal of the American College of Cardiology. Researchers sought to compare the impact of moderate intensity exercise on muscle injury in symptomatic and asymptomatic statin users, plus non-statin using controls. Symptomatic versus asymptomatic was determined by the presence, localization, and onset of muscle cramps, pain, and/or weakness using the statin myalgia clinical index score. Researchers also examined the association between leukocyte CoQ10 levels on muscle injury and muscle complaints, since statins may lower CoQ10 levels and reduced levels can predispose people to muscle injury. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.